Have you ever wondered why the first thing a nurse does when you visit a hospital is check your vital signs? Well, these simple measurements play a crucial role in healthcare, acting as the body's basic language of health and wellness. The vital signs we're referring to are temperature, pulse, respiration, and blood pressure. Each provides a snapshot of your body's overall functioning and can reveal potential medical conditions. Firstly, there's body temperature. It's a reflection of the balance between the heat your body produces and the heat it loses. Normal body temperature can vary depending on the person, the time of day, and the weather, but generally, it hovers around 37 degrees Celsius. A significant rise in body temperature signals a fever, often indicating infection or illness. Next, we have the pulse. This rhythmic throbbing is your heart pumping blood through your arteries. A healthy adult at rest typically has a pulse rate between 60 to 100 beats per minute. A pulse rate too high or too low can be a sign of a heart problem or other medical condition. Then comes respiration, or the act of breathing. By observing the number of breaths a person takes per minute, we can learn a lot about their health. In adults, a normal resting respiratory rate falls between 12 and 20 breaths per minute. Changes in this rate can indicate issues with the lungs or heart. Lastly, there's blood pressure. This measures the force of blood pushing against the walls of the arteries. A reading consists of two numbers, systolic and diastolic pressure. The former measures pressure when the heart beats, while the latter measures pressure when the heart rests between beats. Normal blood pressure for adults is typically around 120/80 millimeters of mercury. High or low blood pressure can be indicative of various health issues. By gaining a thorough understanding of these vital signs, healthcare professionals can quickly assess an individual's basic bodily functions. These measurements provide a baseline for comparison, helping doctors and nurses identify what's normal for each patient and what could potentially be a sign of a health issue. So the next time you're in a healthcare setting and a nurse is checking your vital signs, remember, these aren't just routine measurements. They're an essential part of healthcare, providing valuable insights into your health and well-being. Understanding vital signs and their significance is crucial, not only for healthcare professionals, but also for anyone interested in maintaining their health and wellness. In a world where health is wealth, it's these vital signs that help us speak the language of the body, listen to it, and understand its needs. Each heartbeat, each breath, each degree of heat, and each pressure point tell a story. And in healthcare, these stories are what guide us towards diagnosis, treatment, and ultimately, recovery.